All right, Dr. Block, thank you so much for being with us. We really appreciate your time. Thanks, and your first time here on The New Normal.
Thanks so much, Macy, for having me.
So let's get right into this first question. We don't have a lot of time, but a lot of people asking this question today. Are our current vaccines and booster shots enough to protect us from these new COVID variants that we've been seeing?
Yeah, I think what we've been seeing with the vaccines and the booster shots is that they're really great at protecting us from severe illness. And I think in a lot of ways, that's what's most important. Even though infections are up this week and this month across our region and across the US, hospitalization, severe illness, and death has not been rising. And I think that's reassuring that our vaccines, much as they may not protect us 100% from getting COVID, will protect us against severe illness, which is what all of us are really most concerned about, the kind of infections that put us in the hospital and give us higher risk for long COVID symptoms.
Right, those milder infections are a good sign for sure, something to be thankful for considering what we've been through. But we've been seeing this new subvariant making its way across the country, BA.2.12.1, now accounting for roughly 1 in 5 new cases, according to the CDC. So health officials say they believe it's nearly 27% more transmissible than BA.2. Dr. Block, we've all noticed the rise in cases. You know, for a while, none of us knew anyone that had COVID. Now we're all hearing our acquaintances, our friends, our family do have COVID. They're testing positive. Governor Kathy Hochul in New York is saying it is these variants that are to blame. What are your thoughts? Is it this new strain that we're seeing?
Yeah, I mean, I think since Omicron came on the scene, around the beginning of 2022, I think transmissibility of this virus has been a huge problem. And that's the reason that about 50% of our country or more has been infected since the new year, since Omicron came on the scene. I think, all of these new strains are extremely infectious, and that's why we're hearing about these infections even in our friends, our colleagues, and ourselves who are vaccinated and perhaps even boosted. But what we're at least thankful for is that people do not seem to be getting deathly ill with this infection. And most cases do seem to be mild. And so I think what we're seeing with these new strains, whether it's the A12, the 3, the 4, the 5, there's a bunch of new strains that are out there in the world. And it makes sense that with not all of the world being yet vaccinated, new strains will continue to be upon us, one after another during this pandemic, which is becoming endemic. It does not seem that these new strains are causing more severe infections, thankfully.
That is